again, Dr. West here, everybody. Episode 2 of the Natural Primary Care YouTube channel. Let's jump right in here. What we're going to do today is I'm going to present you a hypothetical case study, and then I'm going to present you with a real case study, my first case after I graduated school. So, what we have here is a 35-year-old male, non-smoker, 5'10", 175 pounds, not in good shape. Blood pressure 158/75. The chief complaint is chronic shortness of breath, and the previous evening complained of stuffy chest, a fullness in the chest with a little sharp pain to go with it. Lasted about 30 minutes. The patient had a bowel movement and then felt much better. Next day, went in to the doctor's office, and of course they gave him an EKG, which came out normal, but with just a very, very slight depressed ST segment in the EKG. Did some blood work, checked for troponin levels, which are indications of heart attack, myocardial infarction. Came back normal. So prescribed the patient 2 blood pressure medications, a lisinopril and a carvedilol for blood pressure control. Recommended that he change his diet to a low-fat diet. Recommended exercise and then return in 6 months. So the patient gets the meds, takes the meds, but doesn't change the diet, doesn't exercise. 3 months later, presents back at the emergency room with a myocardial infarction, heart attack. Now, as I said, this is hypothetical. Now, in a comprehensive system, such a patient would have gone in, gotten the EKG, gotten the blood test, and then would have been referred down the hallway to someone like myself or another practitioner, TCM practitioner. And case study would then go something like this. Patient presents, same thing in terms of weight, height, all of that. Pale complexion, noticeably pale complexion. And the tongue, which is a major aspect of our diagnostic process, a dark purple tongue with distended veins underneath. And if you look underneath your tongue, you'll see there's like 2 good-sized veins there. These veins were swollen and distended, very purple. An inquiry into the patient's lifestyle. Is a very stressful life, stressful family situation, stressful job situation. And then practitioner would cup or apply a suction to a point on the back, bladder 15. And this point corresponds to heart function and so forth. And then after applying this cupping, this suction, would have produced a very dark purple circle where the cup was placed. The dark purple is an indication of what we in TCM call blood stasis. Blood stasis corresponds with the patients that have problems with coronary artery disease, literally, in many cases, thick blood. So there's a correlation there between blood stasis and high fat, thick blood. So the diagnosis was potential coronary artery disease due to heart blood stasis, and that's generally how we do our diagnosis. We give a Western diagnosis, and then we differentiate into a TCM diagnosis. So we have potential coronary artery disease due to heart blood stasis. So the treatment principle would be to move the chi and move the blood. This will make more sense as we get further along in our classes and stuff. So move the chi, move the blood. Gave the patient a formula, shui fu ju yu tang, which is reduce the stasis in the mansion of blood decoction. It's a very old formula, goes back, and it's specifically for just this sort of thing, coronary artery disease. Coronary artery disease is not new, been around for hundreds, thousands of years. And then a heart exercise, a specific heart medical qigong exercise, and that's the what you call the he-ha exercise. And if you look in our body of work here so far, you'll see a little clip there of me doing the he-ha exercise, specifically to build up heart function. And then dietary recommendations. And depending on the practitioner, these are going to be very specific dietary recommendations. Some of it is about maybe lowering the fat in your diet, but also incorporating foods that are heart healthy and actually build heart function and help to keep the blood thin and moving. And so returned 1 month later with improvement. He'd been doing the exercise, been doing the taking the formula as well as his blood pressure medications. It was great. Come back once a month, for 6 months, and patient would be in really good shape and not on the verge of a heart attack. Now that's a hypothetical situation, and it just demonstrates how complementary medicine can and could and should work, where you have an MD on one side of the hall and a doctor of Oriental medicine on the other side of the hall, and they work in conjunction with each other. Now, to move on to my actual very first case, and this was in Key West, Florida. Must have been about 2006, I believe. Latter part of 2005, early part of 2006. A 41-year-old female appears to be in relatively good shape, but she had had a mechanical heart valve put into her heart 6 months earlier. She had a resting heart rate of 120 beats per minute. That's double what your normal resting heart rate should be. And this is a common sort of thing, especially with mechanical heart valves. There's not a clear understanding about why this happens, nor is there a clear understanding about how to deal with it. They had tried a couple of different medications, which had not worked. Her tongue was pale with a red tip. The paleness indicates a qi deficiency, and the red tip indicates a problem with the heart, either heart yin deficiency or something along those lines. The patient was on Coumadin, and this, of course, is very common for people with heart valve replacements, especially mechanical heart valve replacements. You want to keep the blood very thin so that it doesn't clot and cause a stroke or something like that. And Coumadin, commonly known as the rat poison drug, it was actually used for rat poisoning because it thins the blood to the point where the rat dies of internal bleeding. But it was used in treatment of heart disease back in the 50s, 60s, up into the 70s. And then they really kind of got away with it. They had better thinners. Coumadin has a very narrow therapeutic window, which means that it must be maintained at a very specific level in the bloodstream. Too little, you don't get the positive effect from it. You don't get the blood thinning effect that you would like to have. Too much, and you run a risk of internal bleeding. So the Coumadin has to be monitored, usually about once a week or so, sometimes more, depending on the patient. And so when you have a patient on Coumadin, you have to be very careful about giving herbs, because some herbs might decrease or potentiate the effect of the Coumadin. So I was thinking about, exactly what to do for this patient. My very first case out of school. And you have to be careful what you wish for, because all through school, I always said to myself and anybody that would listen, TCM is internal medicine, and we should practice that internal medicine, and we should practice it at the highest form that we can. And so that's what I wanted to do. I wanted serious cases of internal medicine. My very first patient was a very, very difficult patient to figure out. But I hit upon this idea, and I prescribed a single herb, which is not that common. We usually give formulas, as I mentioned before. And the single herb was renshin, or ginseng, Chinese ginseng. And I chose this because it's adaptogenic, which means that it kind of does what you want it to do. It kind of does what it needs to do in the body. However, it does have a slight blood thinning effect, and so therefore has potential to potentiate the Coumadin, so that now the Coumadin is working along with the ginseng, and now the patient's blood would be too thin, with risk of internal bleeding or stroke or something like that. So before I did this, I called the patient's cardiologist and had a conversation with him, told him what I wanted to do, and I mentioned that one of the things that would be necessary would be to double check her Coumadin level. Instead of once a week, maybe we're going to check this twice a week, because of the possibility of the ginseng potentiating the Coumadin. At this point, I think that he was kind of out of tools in his particular little toolbox, and he was all for it. So we started her on a dose of ginseng, just 1 gram of powdered ginseng 3 times a day. After a week, they were checking her Coumadin levels, her thrombin time, her clotting time. And they adjusted her Coumadin down a little bit, because the ginseng had potentiated it just a small bit. So they titrated the Coumadin down a little bit, and then they're checking twice a week, and it seemed to be stabilized. After 6 weeks of this herbal regimen, the patient's resting heart rate had come down to 90 beats per minute. Still a little fast, but certainly much better than it was. And after 8 weeks, her resting heart rate was down to 75 beats a minute. Her energy level was up, and she was able to function better and exercise a little bit. When you have tachycardia, racing heart rate, at 120 beats a minute, you're going to feel exhausted pretty much all the time. And that was one of her other chief complaints, was just didn't have energy. Get up off the couch, walk to the kitchen, and just be completely exhausted. So heart rate was down, energy level was up. The cardiologist called me and actually congratulated me on my success, which was very gratifying, and that really helped water the seed of comprehensive medicine in my mind, that maybe we need both of these medical paradigms to really deliver high-quality health care. And so that was the beginning of my move towards comprehensive medicine. A lot of TCM practitioners sort of eschew Western medicine, if at all possible. I think they work better when you put them both together. And so the patient was taking ginseng 1 gram twice a day. We put in a little American ginseng as well, which oddly enough has a slightly different properties from Chinese ginseng. And gave her 1 gram of that once a day. And that was 15 years ago, and as far as I know, the patient is still doing just fine. So there's a hypothetical case study and an actual real case study of how comprehensive medicine should work. Now, we're going to have some more case studies in the future, And again, I want to remind everybody what the goal of this channel is. What we're trying to do is to implement comprehensive medicine throughout the United States and throughout the world, indeed. So to do that, we're looking to build a coalition of patients and practitioners. So if you're a potential patient, contact us. We'll give you a reference for a local TCM practitioner if you need to find one. And we can also give you some tips on how to set up your sort of own local comprehensive medical team just for yourself. If you're a practitioner, we want you to contact us. Get on our reference list. We want practitioners from every state to be on the list. By getting on the list, that means that there's a possibility of referring patients in your state or in your region to you. And we also want you to join, I guess we're going to call it the TCM Congress for lack of a better name. If somebody has a better name, we'll consider that. But a TCM Congress, which is to improve the access to TCM and comprehensive medicine, to improve the scope of practice for practitioners. As I said before, this scope of practice varies from state to state. In Florida, it's primary care. In other states, it's adjunctive care, and you must have a doctor's prescription or a referral, and then after a certain amount of time, if there's no improvement or any change, then you have to be referred back to the MD, and it becomes very convoluted and confusing. And so what we want is a basic scope of practice for everybody all across the country, so that it's the same in one state as another. This will take efforts, legislative efforts, local grassroots awareness efforts. So give us a call so that you can join in that process. And also, we'll give you some tips or some hints about maybe how to approach conventional Western medicine practitioners in your area to discuss comprehensive medicine with them. I think a lot of TCM practitioners are a little reluctant to talk to CWM practitioners for various reasons. Maybe they don't have the confidence, maybe they're afraid of being dismissed. And so there's a way, we think, that is best to go about that. Get in touch with us, and we'll help you figure that one out. And so if you can support these efforts, and we hope that you do, you can go to patreon.com/naturalprimarycare. You can make a donation there. You can make a one-time donation. You can make a recurring monthly donation. That will help a great deal. At some point, we'll get some videos up there just for our Patreon supporters and so forth. You can go to our website, naturalprimarycare.clinic. Order some tonic herbal formulas. We have a handful of tonic herb formulas there that are clinical grade. You cannot get these anywhere else. And you can also join the online herb clinic. So you can do all of that at naturalprimarycare.clinic. And I think that's it for this little episode. We're going to make this one a little bit shorter than the last one. So the length of the episodes, I think, will vary depending on the topic. So that's it for today. We'll have some more content coming up real soon. I'm Dr. West. Thanks so much for watching, and we hope to see you real soon. Bye-bye.